Which of the following is the most likely diagnosis? We've got an endometrioma, a follicular cyst, a mature cystic teratoma, a serous cyst adenoma, and a theca lutein cyst. It's a 30-year-old woman presenting to clinic with lower abdominal pain for the past month. The pain is intermittent and not related to her menstrual cycle. Physical exam reveals a palpable mass in the lower abdomen, and an ultrasound of the pelvis shows a 10 centimeter cystic mass in the right ovary with solid components and calcifications. So, just going down the list, endometrioma doesn't really make sense with her age. A follicular cyst, I would think that would be related to her menstrual cycle. Also, not entirely sure where that would be. A mature cystic teratoma doesn't make sense because we would see like hair or sebaceous, or we'd see all sorts of weird tissue in there. A serous cyst adenoma makes sense as a benign mass. She doesn't have any signs of anything going to a malignant stage, no weight loss or anything like that. A lutein cyst would probably have some hormonal changes, so I'm gonna go with serous cyst adenoma.
Final answer.
Yeah.
Okay, so the reason why mature cystic teratoma makes better sense here. So
Okay.
for one, right, let's talk about this, right?
Yeah.
Um, it's not related to our menstrual cycle. So things like endometrioma, right? And follicular cysts, right? Those are going to be kind of a little bit related to hormonal changes, right? So unlikely there. Then you have a theca lutein cyst, which sometimes also does a little bit with the cycle. So now you're down to a mature cystic teratoma versus a serious cyst adenoma. Okay. So 10 centimeters, big or small?
Big.
Freaking humongous, right? 10
Yes, it's
centimeters
huge.
is huge, right? Also, on top of that, right, it talks to you about solid components and calcifications, right? So
Okay.
if you remember with the teratoma, right, you can get cell layers from, from every, I mean, cells from every layer, right? Your endoderm, your ectoderm, and your mesoderm, right? Throwing it way back to embryology, right? But
Yeah.
practically what I'm trying to say is you can see things like, you can see tissues from, vessels, tissues from, teeth, hair, right? And so
Okay.
you can see those calcifications in there too. So more
So it's
likely than
describing the teeth without saying there's teeth in there.
yeah, I would say, right? So calcifications, all right, bony structures, things like that. So just remember, and especially teratomas, they usually say that they're pretty large for the most
Okay.
part too. So let's talk about kind of serous adenoma, benign epithelial tumor filled with clear watery fluid because it's serous. So you wouldn't expect any calcifications or solid. Okay, so without solid or calcifications.
Okay.
And theca leukocysts, benign hormone responses, ovarian cysts, often associated with high levels of HCG, in such cases, multiple gestations, molar pregnancies, or ovarian hyperstimulation syndrome. So, these are going to be kind of obviously dealing with your hormonal changes. Does it make more sense?
Yes, that's fair.
Yeah, the serous. Just remember, serous just means like fluid, right? Like your serum from your blood is kind of. I always say like when in surgery when people are healing, they're like, oh, what is that clear reddish pinkish fluid that kind of oozes? That's your serous, right? That's why sometimes when you look at drains, we always call it serosanguinous, right? Meaning
Yeah.
watery pinkish tinge, right? So
Yeah.